In this episode of the Joe Rogan Experience, Joe Rogan welcomes former Texas Governor Rick Perry and Bryan Hubbard, who has a background in public service and has been deeply involved in addressing the opioid crisis. The conversation covers a wide range of topics, including the opioid epidemic, the potential of plant medicine, particularly Ibogaine, and the challenges faced by veterans. Perry and Hubbard delve into the devastating impact of the opioid epidemic in the United States, particularly in states like Kentucky and Texas. Hubbard shares his experience as the chairman of the Kentucky Opioid Abatement Advisory Commission, where he oversaw the allocation of $842 million in settlements from opioid distributors and manufacturers. This funding is intended to combat the crisis that has claimed countless lives and devastated families across the nation. The discussion highlights the systemic failures that allowed the epidemic to flourish, including the overprescription of opioids and the lack of adequate support for those struggling with addiction. Perry emphasizes the need for a comprehensive approach to address the crisis, noting that the government has often failed to provide the necessary support for veterans and civilians alike. He reflects on the tragic irony of a system that has, in many cases, contributed to addiction rather than alleviating it. The conversation underscores the urgency of finding effective solutions to this public health crisis, as well as the importance of accountability for those responsible for perpetuating the epidemic. The episode places a significant focus on the challenges faced by veterans returning from combat. Perry shares his personal connection to the veteran community, recounting his experiences as the commander-in-chief of the Texas National Guard and his interactions with service members during his time as governor. He expresses deep concern for the mental health struggles that many veterans face, including PTSD and traumatic brain injuries, PTSD, which are often exacerbated by the lack of support from the government. Hubbard adds to this discussion by highlighting the alarming rates of suicide among veterans, which he attributes to the systemic failures in providing adequate mental health care. He emphasizes that many veterans are left to navigate their struggles alone, often resorting to substance abuse as a coping mechanism. The conversation serves as a poignant reminder of the sacrifices made by service members and the urgent need for society to support them in their recovery. A significant portion of the discussion revolves around the potential of plant medicine, particularly Ibogaine, as a treatment for addiction and mental health issues. Perry and Hubbard explain how Ibogaine has shown promise in helping individuals overcome opioid dependence and other substance use disorders. They discuss the unique properties of Ibogaine, which can reset the brain's neurochemistry and alleviate withdrawal symptoms, often with just one treatment. The conversation also touches on the historical context of Ibogaine and its classification as a Schedule I substance, which has hindered research and access to this potentially life-saving treatment. Perry expresses frustration over the government's reluctance to embrace alternative therapies that could benefit veterans and others struggling with addiction. The discussion highlights the need for a paradigm shift in how society views and approaches addiction treatment. Both Perry and Hubbard share their personal experiences with Ibogaine, emphasizing its transformative effects. Hubbard recounts his wife's journey with Ibogaine, detailing how it helped her overcome a long-standing mood disorder that had required medication for years. He describes the profound spiritual and emotional healing that both he and his wife experienced during their treatment, reinforcing the idea that Ibogaine can provide not just physical relief, but also a deeper connection to one's sense of self and purpose. Perry echoes these sentiments, sharing stories of veterans who have found hope and healing through Ibogaine treatment. He emphasizes the importance of creating a supportive environment for individuals undergoing this therapy, as the psychological and emotional aspects of recovery are just as crucial as the physical. Their shared experiences serve as powerful testimonials to the potential of Ibogaine as a legitimate treatment option. The conversation highlights the critical need for further research and legislative action to facilitate the use of Ibogaine and other plant medicines in treating addiction and mental health disorders. Perry and Hubbard discuss their efforts to introduce legislation in Texas aimed at establishing clinical trials for Ibogaine, which would provide valuable data on its efficacy and safety. They emphasize the importance of collaboration between government, medical professionals, and researchers to ensure that these treatments are accessible to those in need. Hubbard shares insights into the challenges faced in Kentucky when attempting to advance similar initiatives, noting the resistance from certain political factions. He expresses hope that Texas can lead the way in embracing innovative treatment options, setting a precedent for other states to follow. The discussion underscores the importance of public awareness and advocacy in driving change within the healthcare system. Perry and Hubbard address the stigma surrounding addiction and mental health treatment, particularly when it comes to the use of psychedelics and plant medicine. They discuss how societal perceptions have been shaped by decades of misinformation and fear, which have hindered progress in addressing these issues. Perry reflects on his own journey from skepticism to advocacy, emphasizing the need for open-mindedness and a willingness to explore new treatment options. The conversation highlights the importance of education in dispelling myths and misconceptions about plant medicine. Perry and Hubbard stress that by sharing personal stories and scientific evidence, they can help shift public perception and encourage more people to consider alternative therapies. Their commitment to raising awareness serves as a call to action for others to join the movement for change. Philanthropy plays a significant role in advancing research and treatment options for addiction and mental health issues. Perry and Hubbard discuss the support they have received from various philanthropic organizations that are committed to funding research and clinical trials for Ibogaine. They emphasize the importance of collaboration between the public and private sectors in driving innovation and improving access to treatment. Hubbard shares examples of philanthropic efforts that have successfully funded research initiatives, highlighting the potential for similar partnerships in Texas. Perry expresses gratitude for the support they have received, noting that it is essential for creating a sustainable framework for treatment. The conversation underscores the need for continued investment in research and development to ensure that effective therapies are available to those in need. As the discussion progresses, Perry and Hubbard express optimism about the future of mental health treatment, particularly with the growing acceptance of plant medicine. They believe that as more people become aware of the potential benefits of Ibogaine and other psychedelics, there will be a shift in how society approaches mental health care. Perry envisions a future where innovative treatments are integrated into mainstream healthcare, providing individuals with the support they need to heal and thrive. Hubbard echoes this sentiment, emphasizing the importance of continued advocacy and education to ensure that these treatments are accessible to all. He believes that by working together, they can create a more compassionate and effective mental health care system that prioritizes the well-being of individuals. The conversation leaves listeners with a sense of hope for the future and the potential for transformative change. Throughout the episode, both Perry and Hubbard emphasize the importance of community support in the recovery process. They discuss how individuals who have undergone Ibogaine treatment often benefit from being part of a supportive community that understands their struggles and encourages their healing journey. Perry highlights the role of veterans organizations and peer support groups in providing a sense of belonging and connection for those in recovery. Hubbard adds that community support can be a crucial factor in preventing relapse and promoting long-term recovery. He believes that by fostering a culture of understanding and compassion, society can help individuals feel less isolated in their struggles. The conversation serves as a reminder of the power of community in facilitating healing and transformation. In closing, Perry and Hubbard issue a call to action for listeners to get involved in advocating for change. They encourage individuals to reach out to their elected representatives, share their stories, and support initiatives aimed at advancing research and treatment options for addiction and mental health issues. Perry emphasizes that change is possible when people come together to demand it, and he believes that Texas can lead the way in this important movement.